Okay, so I've arrived on scene. Make sure the scene is safe and there's no dangers present to myself, patient. Wait. Oh. Alright, so start again. Shut up, you've got chest pain. Zip it. Alright, cool. So I've arrived on scene. I'm just making sure that the scene is safe. There's no dangers present. Also got the correct and appropriate PPE. So right now I'm just going to wear gloves, no glasses. I'm going to introduce myself to the patient, gain a bit of a reading, and also explain to them what's involved in taking a 4-lead ECG. So, hi there, my name's Reese. I'm from the ambulance service. What's your name?
Aisha.
Aisha, nice to meet you, Aisha. So you've called us here because you've got a bit of chest pain. So what you do, yeah? Yeah, that's not good, not good. Righto, so what we might do is I might run a 4-lead ECG. It's going to involve me in putting 4 little stickers on both wrists, both ankles. Doesn't hurt, non-invasive. You okay with that?
Yeah, that's alright.
Cool, so I've now explained the procedure to the patient to run a 4-lead ECG. So what I might do is I might place my 4 stickers where required. So we now have our 4 electrodes on the patient at the moment. We're going to connect them to the life pack, and to give us a good overview, I'm just going to pop it in lead 2. If required, when placing the electrodes on the patient, we could clean, shave, abrase, wherever sort of need be. We're quite lucky here, so the patient is clean, shaved and abrased, so we can pop the stickers where need be without any issues. So Aisha, now what this is going to do is going to allow me to have a good look at your heart to see whether there is any abnormalities, because you have complained that you do have some chest pain. We're going to have a look in lead 2, which is a good way to look at it because it comes from top right down to bottom left, with the positive lead being down on the bottom left. And then we can have a good look at what's going on. Cool. So we've now got the leads on, we've plugged it into the life pack. We're going to have a look at lead 2. So we're going to press the print button, and out prints our print button. So here we have our printout. We can see atrial fibrillation here, so there's an unorganised atrial depolarisation. So you can see between the QRS complexes, there's a lot of abnormalities there. It's irregular. Alternatively, we could have atrial flutter. So as you can see, the fluttering between the QRS complexes. Also supraventricular tachycardia. You can see very wide ventricular complexes, and it's unable to sort of identify where the P waves or the T waves are. I'm just going on to the second page of my notes here. Looking at junctional rhythms, you can see an inverted P wave, which is a good signifier of a junctional rhythm. Moving down to heart blocks as well, we can also see that down here. Right.